going to do.
Okay.
And then I'll talk to you about risks and benefits, and then I'll answer your questions.
Okay.
Have you had a port before?
Never.
Okay. So let me tell you about that. There's two parts to it.
Okay.
There's a reservoir. If you look down on the top of it, it's about that big.
Okay.
And if you look on the side and profile, it's about that thick.
Okay.
And it sits just under your skin.
Okay.
Your cancer is on the right, so we'll probably put it on the left if you're okay with that.
Correct.
So it'll sit just under your skin, above your breast, just below your collarbone.
Okay.
All right. And then the second part is a small caliber tube
Mhm.
or catheter.
Okay.
It's hooked up to it, and it travels under your skin, over your collarbone, and
Down towards the heart.
in the biggest vein in your body, just above the heart.
Okay.
All right. It takes about 20 minutes to put in.
Mhm.
It's fairly quick.
Okay.
All right. First thing that's going to happen is you're going to get an IV. Got an IV. The nurse is going to give you a sedative.
Okay.
You're going to fall asleep,
Mhm.
hopefully.
Mhm.
At the least, you'll be able to relax
Okay.
and just kind of take it easy.
Okay.
Then I'm going to give you a local anesthetic in the
Mhm.
form of lidocaine here at the chest wall,
Mhm.
where the port is positioned, and then over your collarbone where the access to the vein
Okay.
is made. The combination of those medications makes most people very comfortable.
Okay.
If you feel anything sharp, uncomfortable, let me know and we can give you more medicine.
Okay.
The nurses are really good
So yeah.
about assessing your comfort,
Okay.
and they'll adjust the sedative
Okay.
if they need to.
Okay. So I will be asleep for this.
You'll be asleep in the sense that you'll be asleep on your own. You'll still be breathing.
Okay.
All right, we're not going to put a tube down your throat and breathe for you.
Okay.
All right. So you'll hear us.
Mhm.
All right. We'll be able to talk. You know, you'll hear my voice.
Okay.
All right. You'll be able to tell me if there's something sharp or something bothering you.
Okay.
Kind of like a dental procedure.
Okay.
Oh,
All right.
okay.
Okay.
So, but you'll be dumb.
Okay.
All right.
Okay.
Risks, bleeding, and infection, just like for the IV in your arm. Same
Okay.
ballpark risk. With the caveat that if this gets infected, it has to come out.
Right.
You have to get a temporary line, and then we'll put it back in once the infection's clear.
Okay.
So all that to say, you're going to go home with wound care instructions.
Okay.
They're simple.
Okay.
Just follow them.
Okay.
Because I know you don't want that.
No, I don't.
I don't want that on my record. That's a bad reflection on me.
Okay.
So we're going to keep you infection free.
Yes, we are. And we're gonna get through this process.
Okay, the benefit, you can get chemo through that. They don't have to find a vein each time you need chemo.
Okay.
All right, so that's a plus.
Okay.
And then the fact that it's in that big vein,
Mhm.
we're not at risk of injuring the vein with the chemo. If we park that in your arm,
Mhm.
in those small veins in your arm,
Mhm.
it would take just a couple of weeks for the chemo to destroy the lining of that vein.
Oh wow.
And
Okay.
then you lose the function.
Okay.
So, those are the benefits. Talked about the risks. Your questions for me?
No.
Either one of you?
No, Steve, I'm Steve.
Steve?
She was very good about, the nurse has already been in and she really literally has gone over everything you just said plus some.
Yeah.
So
Good.
I'm pretty good. I've already had the biopsy, the lumpectomy here, and a mastectomy here. So,
Yeah.
you know, I'm still seeing Dr. Hopkins. So a lot of main thing with anything is sanitation and infection. So,
Yeah. Well, we're gonna
Okay.
do our part.
Okay.
We're good hands. Steve, she'll be back there about an hour and a half.
Okay.
okay.
Not to worry. It's
Okay.
20 minutes from your perspective. But when
Okay.
she leaves, you can put her on the clock. It'll be about an hour and a half.
All right.
So you can come and go as you please.
Okay.
That's just because we monitor you. Because we give you the sedative,
Okay.
we monitor your vital signs about 30 minutes.
Okay.
Through 30 minutes after the procedure to make
Okay.
sure that you're doing okay.
All right. So what time do we start?
You'll be the first case, so hopefully here in the next 30 minutes. Have they drawn your blood?
No.
You haven't had a blood draw? Well, the nurses are usually on top of it. I'll give them a call.
Okay.
If you haven't had recent coags or a blood draw to let us see what your bleeding
Okay.
potential is, then we usually get that before we start,
Okay.
just so we know what we're getting into.